Seton Hall offers both an on-campus and an online MHA program. It's 42 credits, and regardless of whether you take it on campus or you take it online, it's exactly the same program. So you have the same curriculum, in most cases the same textbooks, and in a lot of cases the same faculty that you would have if you were on campus. Well, first of all, it is an accelerated program, meaning that you can complete it online in 2 years. The 42 credits are spread throughout the 2 years. It's a hybrid in the fact that students come to our campus 3 times. They come for an orientation, which is 5 days, and they complete a 2-credit course. They come back a year later. They complete another 2-credit course and spend 5 days with us, and then they come back for the final graduation residency, which is also 5 days, and they complete a course on leadership. Well, first of all, I think you need to look for the integrity of the program. And that's one of the nice things about our program is that most of the employers who know us know that the program is identical to if the students were coming to campus. And there is no distinct difference between the 2 levels of the program. So I think you would have to want to make sure that it is an authentic program. Second of all, I think you need to check and make sure all of the courses are apparent in the curriculum. In other words, if you're at this master's level and you're thinking about doing healthcare management, you need to know enough about healthcare, and you also need to know enough about management. So you should be looking for both business courses and specific courses such as epidemiology, which we cover in our community health, that are distinct to healthcare. You want to make sure you have both of those. I would also add that definitely need to have a financial background. Now, you don't have to be a statistics whiz and you don't have to be an accountant, but you do have to know and have those skills that are relevant to the financial area. Well, we have constructed a matrix for our applicants, and we do not require a graduate exam. So we have a list of things that we look at each individual. Most of all, we look at whether we believe the person has the potential to succeed in the healthcare field. Now, in some cases, that means they have the experience in healthcare. In other cases, that means that they might have come directly from undergraduate but have been an excellent student in, let's say, an area such as sociology or economics or something like that, but they volunteered or done some service work in the healthcare arena. So we're looking for commitment. We're looking for either a service background or some kind of background in the healthcare experiences, a healthcare arena. And then we're also looking for a student that's going to be able to handle the master's level work, because it's a lot of work. So we want to make sure everybody succeeds. Well, I think there are a couple things. In case someone doesn't know that Seton Hall is very close to New York City, however, we're in a very much of a small college town. So I think that's one nice thing that students really like about us. The other thing that I would say is that we have been on the cutting edge with technology and increasing, adding new courses that are very relevant. We are an essential MHA, which means we cover all the courses they need. And the other point, I think, is that just the personal relationship. Every faculty knows every student. And I think at the master's level, that's very important.